Hello and welcome to the special episode of In Conversation with ET Insights, Leadership, Thoughts on Diversity and Inclusion. Today I'm in conversation with Dr. Rajiv I. Modi. He's the Chairman and Managing Director of Cadila Pharmaceuticals. Dr. Modi, thank you so much for having us here and talking to us today. So, before we start and get into diversity and inclusion, it's important that diversity and inclusion has to come from the top. So your thoughts first on your leadership style, your leadership vision at Cadila Pharmaceuticals.
You're asking a question which in my mind is a way of life. So God made a man and woman. They coexist. One cannot survive without the other. So that's what we continue in Cadila. There are boys and there are girls, there are men and women. They coexist. They thrive, they share, they throw tantrums at each other, they have serious discussions, they smile, they laugh. So what I have encouraged, and it's very difficult, I'll tell you, it's very difficult. I don't want to go into the depth of the complexity of that. But we at Cadila have encouraged that there should be some representation of women in management across, from a working level through to top management. And we have people at all levels. So I would say that Cadila has a good blend of men and women at various levels, but we're just starting.
Right.
And I hope that over the decades, and with my friend, my colleague, my son, I think it'll continue.
Because that's important, sir, because in the corporate world they talk so much about this so-called glass ceiling that women have to shatter because you know how it is. So, but it's great, it's important, and it's heartening that Cadila Pharmaceutical is taking the steps.
More so also, I think, women also, I would say, it's challenging for them. I mean, maybe for a man it's way of life, but for a woman to sit in a high-level meeting, to open and share her views, more so when she has a point of view to say which is distinct from others, it's challenging for them. So, but I think we allow that to happen and we encourage that to happen. And hopefully for a very simple goal, to see how we can progress as a company better. There's a very simple way which I have realized of recognizing whether things are working or not. So when I walk in corridors or sit in the meetings and I look around, and if I see a girl or a woman give a pleasant smile, I know that things are working. But if they are totally flat-faced, non-responsive, then you know that, really not being handled or treated properly.
Wow, that's a very important.
So it's my way of finding out that are they, in that ecosystem, are they being recognized, involved, and so on.
Very important. So very important way to see such a minute thing, but to get so much depth from it is really fascinating. So I want to take one step back and now talk a little bit about Cadila Pharmaceuticals, the organization. In being in pharmaceutical industry, innovation, R&D is most important. Your thoughts on that? How are you keeping up to pace and just using using all resources to stay up to date with changing times?
So about the foundation of the wonderful work, pioneering work done by my parents, how the company was founded and so on, how we started doing different things, maybe just after independence in the 40s and 50s. But continuing now, Cadila, as per the need of the market and as per its current positioning, essentially supplies high quality, affordable generic medicines to people in India around the world. At the same time, periodically, we have been successful due to the tremendous work done by our research in bringing out innovations. And we have been very lucky in doing that and coming out with innovative products over the last decade or so, starting from medicines for the improvement of heart and well-being of people above 40 to complicated medicine for multi-drug resistance in tuberculosis. And so again, tells you that of the spirit of trying to find innovations to various vaccines, the first recombinant flu vaccine, the world's first 3-dose rabies vaccine, and more in the pipeline. Recently, a special product which will help increase the level of calcium in the population of our country, where many of the people are deployed of calcium. So there are various areas of research, from treatment of chronic diseases to acute diseases. But it all depends and is because of the dedication of our whole research group and an ecosystem which is built within the company to think of finding better medicines, cost-effective medicines, medicines which are going to be much convenient for the patient to use and develop.
And so one thing I would like to just point out, what I've noticed is that it's not about just looking at medicines for the diseases of the rich, so to say, but it is about you're reaching out to the mass, which is because that is most important. There are so many people who are unwell and can't afford really expensive medicines. So to be providing them those medicines at really cheap prices, that itself is so important. That is what inclusivity also is about.
That's what our company is known for. We've done that. We've spent, zillions amounts of resources, but we've ensured that at the end of the day, our products are appropriately priced, even if they are patented, first in the world, have recognition of not having any competition, but we don't price them above what is affordable.
Most important, sir. When we talk about the industry on a larger scale, there is obviously competitiveness between you, other companies also. How do you manage that both? But I don't mean in the domestic space, in the domestic and international space, because again, Cadila Pharmaceuticals does have its footprints around the world. It's a very tough challenge, managing competitiveness, managing regulatory things around the world. How do you manage these complications?
I think we as a company are determined to succeed in providing the best quality, affordable medicines for people in the world. That being the goal, that's how our legacy has been. All of us are essentially working, learning, meeting regulatories, subject matter experts non-stop. Historically used to be travel, and nowadays electronic ways of communicating, video conferences and so on. But people meet and stay current, whether it's India, whether it's Brazil, whether it's Peru, whether it's South Africa, whether it's Edinburgh, whether it's Washington. People talk. Cadila has representatives, colleagues, employees in different parts of the world. So teams of people which are of Cadila, but of diverse origin, talk among each other in our international forums, in our various cross-functional teams. And I think they keep in touch about what's changing, what's appropriate for the country. And I think that's a job, that's a struggle. So we endeavor to get our products, which are essentially made in India, but also in different parts of the world, make them registered and approved for not only production in that country, but also production and sale in different parts of the world. So we sell products made in Dholka, in Gujarat, in Ahmedabad, sell them to different parts of the world, to North America, to Peru, to Africa. Likewise, we make products in Africa, sell them to Middle East, and so on and so forth.
That's great, sir, because in a way then like pharma is kind of uniting the world also. So let's talk a little bit about CSR and sustainability. Now I know Cadila Pharmaceuticals did CSR even before it was cool to say that we are doing CSR. Your thoughts on the importance of CSR sustainability on the company? I know it's great for the people outside, but in-house, how does it help the company, the employees go about their way of life?
As a way of life, since I was born and I was brought up, we lived in an environment of sharing. And so whatever Cadila Resources has had over the history, we have always shared with the people to make them better. So we have wonderful CSR programs which are recognized by various authorities. And so Cadila's CSR programs are genuine. They are not as a percentage of sales. We spend a lot of money giving back, helping people to have better lives. So whether it's food, whether it's education, whether it's health, whether it's hygiene, whether it's their ecosystem, their environment. We try to do various aspects, and now I'm told more than 100 villages in and across various campuses of ours have some sort of flavor of help, guidance, support from the Cadila CSR team. But I think as people recognize, people working, more than 10,000 people working in India, across the world, the company recognize and learn about the various good things that we do for society, I think they feel happy. When you talk to them on a corridor, one-to-one, they say, oh, they heard of somebody getting a good meal thanks to some efforts of our company. Somebody's cattle getting better and giving more milk, and the farmers are happy because now they can have more produce. Some women having better hygiene and therefore better quality of life.
That's great, sir, because in my experience of having spoken with people, having met people, what I realized, sir, like what you said, the employees are happy and they feel happy that it's not just a company that is running for profits but is looking for the greater good. So I think they bring in that sense of pride, which actually leads to my next question. What steps does Cadila Pharmaceuticals take to attract talent and diverse talent and retain that talent because obviously in every organization, every industry, there's a lot of attrition. So how do you do both those things, attract and retain?
So we have of late, our majority drive is to attract young, fresh graduates of different levels. So whether it's an ITI person or a PhD, but freshers, 1, 2, 3 years experience at the most. So we currently, across all our campuses and all our locations, would love to hire as a principal young people as they come in the organization and give them a possible journey and a path of becoming a boss 5, 10, 15 years down the line. So that's been generally, so about 80-90% of our recruitment for filling vacancies or for filling vacancies which are because of our expansion, our new projects, our new investments, is by hiring young staff. Because today, in today's world, technology is defined. There's a huge level of automation. There's a lot of influence of artificial intelligence and automation in our systems. So a person with a general IQ and some background will be able to adjust. So we get young people and then they allow them to grow in the company. That also means that people who have been in the company, who are senior, they be senior, they're respected. That helps them to say, okay, I'm wanted in the company. So that also helps them to say that they have a secure ecosystem, a secure job in the company, a secure career in the company. So we are operating by bringing in young people when there is a vacancy and having people from within the company as much as possible to grow, to make to get promoted.
Yes.
Based on success.
Lovely. That's great to know, sir. You spoke about technology. Now I also do want to talk to you about technology, and you mentioned artificial intelligence. You mentioned about, of course, the rapid spread of digitalization. But in the context of a pharmaceutical company like Cadila Pharmaceuticals, I won't say importance, because yes, we know technology is important, but maybe the kind of focus that you and the organization is giving on technology to not just streamline, say, supply chain or processes, but also coming back to the earlier part where we spoke about R&D and innovation. So in all those aspects, the role of technology, how are you seeing it? How are you seeing it currently, and how are you seeing it for the way ahead?
So it's, everyone knows about technology, whether the new buzzwords is artificial intelligence. But technology is technology, and pharmaceuticals is a very technology-oriented business. So throughout our life and as we continue, right from identifying a product, developing a product, making a product, formulation in such a way so that it is stable in the heat and cold of the world, is its extended shelf life, is all reactions, analysis, instrumentation, and measurements in a very systematic fashion, which establish that a particular product is going to be safe for a certain duration in various markets. So that's a very simple way of summarizing what pharma companies do. But more than that, I think it's not only the technology is not only in the product that we produce. Of course, that's what people see. But technology also is into ensuring that the way the product is produced in various facilities is such that it has got less adulteration or remnants of impurities, so that the product is as pure, as safe, and as clean as it could be. So that's what we do at Cadila. I mean, all products, whether it's a Cadila or other competing company, they all pass through pharmacopoeia. But then when a doctor understands Cadila, they know that it's really, really just above and beyond what you just expect from a pharmacopoeia. We try to provide the best possible solution, the best possible safe product to people who are ill.
Great, sir. And that is, of course, very important. So what's the way ahead? What's your vision for Cadila Pharmaceuticals for the way ahead?
So Cadilla's vision has been continuing what we have been doing. We are a large pharmaceutical company. Our vision is to continue to increase access and availability of Cadila branded products to people in India, to people in various parts of the world. Our vision is to grow the company. Our vision is to create more jobs. Our vision is to employ young people and retain mature people, to build a formidable leadership team which is recognized, and thanks to them is what we and I am representing as a recognition of all the hard work. So vision is just to be a very reliable, affordable, cost-effective provider of medication for people in need around the world.
Fantastic. So last couple of questions. One very important one that I want to ask you is, for the way ahead, what are some challenges and some opportunities that you see for Cadila Pharmaceuticals?
So Cadila is a privately held company. That's wonderful. We are one of the largest privately held companies, and we continue to stay privately held. So challenges, of course, are that we have to earn the money through hard work, and use that hard-earned money and the resources and some loans to invest in development. So we have to be very careful with the resources that we use. From a finance point of view, from the challenge point of view, I think the world is getting very competitive. There are always various opportunities for people to work. So retaining, building loyal teams of Cadila from juniors to leadership level is important, because there's always attractions for people. There are always choices. But we have been successful in doing that. And beyond which, people do realize the commitment of the company is actually to make high quality, affordable medication, which is beyond just the normal business function of generating sales and profit. So I think our challenge is both on revenue, on people, and of course the ultimate challenge is to continue to adapt and equip our teams, our facilities, to be at the cutting edge of technology. But all in all, I would say, in all the businesses that we run, I think I'm very, very satisfied that at the end of all the hard work, communication, talking to people, we all together are a very accomplished, recognized team, a team which competition is very privy of getting a handle to.
And so maybe one or two opportunities that you see for the way ahead for the company?
We are in the business of medicines. So there are always lots and lots and lots and lots of opportunities. And what we are trying to do is, we as a company are in about 16 to 18 therapy categories, where we have products in these 16, cardiology, gastroenterology, eye diseases, the disease of orthopedics and so on, women's disease. In each of these businesses, we have a nucleus of maybe 5, 10, 15 products from a basket of maybe 60 products, but there are some 5 or 6 or 7 or 10 key products which are recognized in the market. So our opportunity is to grow them and become more and more visible, to become significant in the various therapy areas that Cadila is present, so that we are among the top 5 leadership in terms of providing products for the use of patients.
Amazing, sir. One last question, sir. What motivates Dr. Modi every day to wake up, to come to work and to do the great work that you're doing? What's your motivating force?
You know, I say this to everybody, that if you are in the business of making medicines which are affordable and giving to people who are not feeling well and making them better, it's a great satisfaction. So what we at Cadila do day and night is to produce medicines for people who are not well. We provide them the best quality medicine. We provide them the medicines at an affordable price. And so I think it's a regular charge, because what every Cadilian does is, when they come and work and participate in the office or in their life, being a Cadilian, I think they're helping people. So I think that's satisfying. Pharmaceutical in general is satisfying. Working for an ethical company like Cadila Pharmaceuticals, which has over 7-8 decades demonstrated its strong philosophy of high ethics, morality, and providing the best products to people in the world. You know, it's a story by itself that we have sustained.
Thank you so much, Dr. Modi, for talking to us and for this very insightful interview. Thank you so much.
Thank you.
Thank you for watching this very special episode of In Conversation with ET Insights, Leadership Thoughts on Diversity and Inclusion. Thank you so much for watching.